we'll go ahead and get started. I know we're a really small group. Obviously, we're the rare of the rare. Thankfully, this is being taped, so families who aren't able to make it in person will be able to watch these presentations afterwards. So hopefully that will be helpful. So my name is Brittany Parke, and I'm here to present a project that I've been working on for the past 2 years. I just wanted to start with a slide of my kids, because this is the reason I don't have any fancy letters after my name. I'm not a doctor, but I have these 4 amazing kids. You'll see Drew up there in the top left corner. He was our first son born with Cobalamin G, and unfortunately passed away from the disorder because we didn't know he had the diagnosis. And then on the other side of the corner, Grayson with his superhero costume on. He's our little superhero, and he is now 3. Has been getting treatment and is doing fantastic. So, and my 2 girls, Alexis and Riley, truly I couldn't be up here, and I wouldn't be up here if it wasn't for the 4 of them, because I do it in honor of my sons, and my girls help me a lot. They play with Grayson, and they've helped me so that I can have the time, as well as my husband, to be able to put together this project. So today I'm presenting. It's called a remethylation disorder research map. And you're probably thinking, like, what in the world is a research map? I asked the same question when Margie from HCU Network America said, well, if we're going to start funding research for these disorders, you need a research map. And my first question was, what in the world is a research map? And so I like to think of it as kind of tell you a little story. So we flew into one of the Washington, D.C. airports yesterday, right? Crazy. And we rented a car, and we jumped in the car to come to the airport, or to come to the hotel. And the very first thing we did when we got in the car is turn on the GPS, right? We had no idea where we're going. We're not from here. We don't know how to get to the hotel. And so we turned on the GPS, and it gives you lots of different options, right? It gives you a route in order to take to your final destination. The remethylation disorders, we don't have a GPS, right? No one is going to tell us the best route, right? Because these GPSs were programmed ahead of time. Nerds at computers spent lots of hours mapping out all the roads and driving around and mapping it all out. And they took that time to prepare so that GPS can be easy for us to use, and it makes our life better. And so this remethylation disorder research map is that background programming for our disorder. And the idea behind it is all of this work that's gone into it to create this document and all this information creates a bigger research strategy. And what that is it's the remethylation disorders GPS, right? It tells us how to get there, where to go, and we can set certain preferences. How much money are we willing to spend? Do we want to pay for a tollway, right? That took us out of, yesterday we tried really hard to avoid tolls, and we took a very long U-turn in order to get back to the highway. So really, this research map provides us that direction. So think of we're all on this journey together, right? Like, we're trying to figure out how to improve the lives of our patients, our family members with remethylation disorders. And so this idea that it is this map for us, it gives us that direction of where we're going to go and where our goals are going to be. And of course, in order to get there, we have to have the funds to do it. And so this also is what is going to guide and really focus our fundraising efforts as an organization, so that families know when they're coming to us and participating in our fundraisers that we have a specific goal in mind. We have a specific purpose, and all of their hard-earned money and their time that they spend for our organization is going to be worth it for them. So the very first thing that I did for this project was collect a bunch of literature. So thankfully, with the help of Irene and Jen from the NIH, they helped me compile this really big library of research. It was about 180 articles that I read, all of them, and I understood most of them. There was a lot of Googling involved, and calling our own metabolic specialist and asking him questions. But I read all these articles, and I was trying to understand, what do we actually know about these disorders? and who knows this stuff, right? And so from all of these articles, you have the authors at the beginning of these research articles. And I just started making lists. And I was contacting these individuals. And thankfully, this group of individuals were the ones that responded and participated in a research interview. And so I would meet with them, and based on the literature that we compiled, based on the information we had, we created these questions in these research interviews. You know, what do you know about these disorders? How are they treated? How are they managed? And getting different ideas, and what are you researching in your labs, right? We want to know what you're doing. And so I was able to research these individuals. So the first was Sean Friese in Switzerland. You can see his picture down there. I'm sure most of you know David Rosenblatt from Canada. Manuel Schiff, who has a pretty large population of severe MTHFR patients in France. Sean McCandless, Peter Baker, both from Carl Children's, and we have the pleasure of them being my son's doctors as well. And Nicola Longo from the University of Utah. And I don't have Vesper is here with us. I also was able to interview her. She represents Pfizer Pharmaceuticals. So I interviewed all these clinicians and all these questions, and all of the literature and all of the information I gathered from these interviews is what is compiled into this research map. So I don't have time to go over all 26 pages, like I wish I did. But I will tell you, I brought copies with me. So if you are interested in like the details and the specifics about it, please come find me and I'd be happy to share a copy with you. Soon it will also be launched on our website. So you'll be able to access that document as well. But I just wanted to highlight a couple of key parts to this research map and how we developed our research strategy. So the very first thing we really needed to figure out is which disorders are we going to include. Now, we had a great presentations this morning, understanding the differences between the different cobalamin disorders. And that kind of ties in to which disorders are similar enough to each other that we could include them together. Because if they're not similar enough, then the research map, it wouldn't be coherent as far as understanding different disorders. So you can see here, we included this cobalamin F, cobalamin J, cobalamin C. Oh, I went forward. Cobalamin C, D, E, F, and severe MTHFR. Not included are cobalamin A and B because they only present with methylmalonic acidemia, not high homocysteine. We did not include the trans cofactor disorders right here on the, it happens right on the edge of that cell barrier, and cobalamin X. Those could be included in the future, and if we start to see patients if they come talk to us and we start to see families interested in something and beginning research, that's something that could be added in the future because they are similar. They're just very severe in their how they present and their symptoms, and very, very rare as well. And so that's the scope of this research article. Those are the disorders we're including. So I know some of our families for cobalamin C might be next door in Organic Acidemia Association, and if you know them, please tell them this includes them. And if they're interested, have them come see me, and I'd be happy to share. If they missed this presentation, I'd be happy to share with them what we're talking about for cobalamin C and the other disorders as well. So once we figured out, okay, these are the disorders we're going to talk about, what is going on in the bodies of our patients? And we really want to understand where in this process the dysfunction occurs. And thankfully, Kim did a fantastic job showing us where that dysfunction occurs. So this is one of the graphics that's a part of the research map, and it basically describes where in this pathway, right at this methionine synthase enzyme, you see that right in the middle, MS, it's crossed out with blue, where exactly in this cycle each of these disorders is a dysfunction, right? And Kim talked about this, the B12 dysfunctions being those C, D, E, F, J, and then the cobalamin G is that dysfunction right at the enzyme. And this was really important because we really wanted to know, and the question I have in my mind as a mother is there a golden ticket, right? And what I mean by golden ticket is there something that someone could develop that would be curative or provide better clinical outcomes for this whole group of disorders, right? Like if we fixed one area, would it help all of them? And that was the big question, is there something? Unfortunately, I think the answer is probably no. Right now, there's not. I mean, maybe in the future, if we understand it better, maybe that's just my optimism as a mom, I think. But right now, not really. We really do have to do, each one of these has a very distinct pathway. And we see, so this is kind of like our zoomed in picture, right? We're trying to get an understanding of this pathway. Now we're gonna zoom out and we're looking at the big picture. So again, Kim, she apologized for her pathways. I apologize too. I have a deep love for graphics and color coordinating. My husband was getting really sick of me bouncing all of these diagrams off him throughout the last year, but he puts up with it. So now we created this graphic. Sean Friese in Switzerland helped me put this together, and we really wanted to put all the pieces together and create this big picture, right? Like, where are each of these genes causing the dysfunction? Where are the cobalamin disorders individually causing these problems? And then on top of that, where are the therapeutic approaches we already have? So you can see in the purple, the betaine, and where it creates a new pathway. You can see the hydroxycobalamin directly targeting that methionine synthase enzyme. And then the other supplements we don't really have data about, but we know patients still do take it, and clinicians are basically experimenting with those different types of supplements. And then in red, those are the different areas that are pinpointed to cause disease manifestations. So the symptoms you see in your patients, generally that is the area of the pathway that is causing the problem. And really this picture kind of gives us this zoomed out look of, if a researcher has an idea of where they want to start providing new therapy or where they want to start understanding this pathway better, we can understand from this where they would be moving forward. Because we don't want to fund research about information we already know, right? We don't want to waste time. Our kids are living now, and we want to find treatments now. And so we want to move forward in our research and what we know in science. And so this is really putting out there what we know, and we want to add to this picture as well. So once we kind of got that idea, I did kind of a search for clinical trials, and unfortunately, it didn't take me very long. You can see there's not a whole lot going around in the realm of remethylation disorders. So I can kind of give you an idea of the three that I was able to find, and these were just on the databases for clinical trials that are open to the public. So we have the first one here, which was actually just published. Kim put it up on the screen as one of the articles. But Dr. Manuel Schiff, he's one of the researchers I was able to interview. He just recently published from this clinical trial that is the first listed there regarding betaine dosages. And so that just, his conclusion was trying to figure out what the optimal dose is for mainly cobalamin C and severe MTHFR patients. And so those results have been published, and I don't believe that's going to move on to any phase 2 or phase 3 trials. The second study listed here just is starting its recruitment process. It's a longitudinal study, so they're actually looking at lots of different rare diseases and how it affects neurological functioning. And so it's not specific to remethylation disorders, but they are included in this study. The only problem is it's in Italy. And so, I guess we could all move to Italy together. So, I don't know. I kind of would like to move to Italy. So, you do have to live there or travel there, and it seems pretty frequently in order for them to participate. And they also are only taking patients over the age of 18, so that would exclude any pediatric patients from this study as well. And then last, which I think is a great opportunity to shout out there, is the natural history study at the NIH, at the National Institute of Health, which is a study that, and don't get thrown off by this, because I've talked to a few families today about it, but it's called methylmalonic acidemia and related disorders. We're the related disorders. So if you're interested in participating in this natural history study, There are people here, come talk to me and I can get you in touch with them. But it's a great way for us to collect that data and really understand the long-term effects of our kids and what's happening to them in their life. So that's what our clinical trial, this is what the atmosphere looks like. I hope that all of us are back here in like 5 years and this is like a multiple slide section. That's my goal. Thanks. Good job, Dana. We need more research, we need more clinical trials. We need this to grow. And the best way we can do that is by being together and really showing the industry that this is what we want. So based on all this information that's compiled in this nice long report, we took all of this. What do we know? What don't we know? Where do we want to go? Where is our GPS leading us? What are we willing to sacrifice? What do we not want to sacrifice? You have to put all of that in this algorithm and you create a research strategy. So as an organization, again, like I said, we value every penny that comes in from families when they fundraise because it's a sacrifice. We understand what it's like. It's financially hard when you have a child with a rare disease. And we want you to know that the money that we're giving out in grants has been fully vetted and we understand, and this is information we need to know and imperative in moving forward for these disorders. So we created a research strategy. So what are we going to focus on? Where are we going to put our effort and what can we do, right? Like what's our next steps? Because it's not enough to say, well, we need all of this, right? How do we get there? How do we get to these places? And so this will all be available as well on the website soon. We're going to put it out in the newsletter as soon as it is available online, so that you can share it and look at it in more depth. So really the 4 areas are going to be screening and awareness, pathology and natural history, optimizing the current treatments, and new treatment modalities. So we want new treatments for these patients. So looking at each of these individually, what can we as families do? Okay, so screening and awareness. Newborn screening, there is no reason why we are not screening our babies, right? We have treatments. We know they work. Come talk to my family. We know they work. My first son passed from this disorder. My second son, amazing. Such a difference. We need to be screening, and we're working on that. As an organization, we are talking with state labs. We're trying to look at a 2-tier process for newborn screening, lowering methionine cutoffs. They already test for methionine. Could they just adjust that methionine cutoff a little bit? And could they find these babies with low methionine, and trying to weigh are they going to find too many babies that don't have the disorder, trying to find these babies before damage is done. And so that's an important area for advocacy, as well as detecting late onset patients. We know that there can be some patients that present later in life, not many, again, we're all very rare, but not many. But helping pediatricians and general practitioners understand the red flags to start diagnosing and looking for metabolites, right? So if a child is coming into their clinic and they're showing signs of developmental delay or vision impairment, seizures, feeding difficulty, all of these symptoms that we see with our kids before they get treatment, helping them understand that they should be checking for these metabolites. Homocysteine is a simple blood test, right? It's easy, right? So we need to educate physicians, help them understand that this is something they can easily test for, and then there's a treatment. And that again goes towards sharing our stories with physicians and being outspoken. Sometimes it's hard, right? Like sharing your story is very personal. And it can be really hard, but at the same time, the impact you can make from sharing your story and your experiences is tenfold in the community and can help so many people. And as well as improving the awareness and collaboration among patient organizations. So what you're doing here today is exactly that. Joining here, Organic Acidemia Association with HCU Network America, the Propionic Acidemia Foundation, us coming together as patient organizations and getting work done, right? Like we just funded a Cobalamin C grant to a researcher, I believe in Italy, in Italy. Yeah, and it was jointly funded. Like, it's collaboration, and that's how we're going to really work and move forward. Let me get through this quickly too. Next is pathology, natural history. You guys are going to hear from Rarex and Coriel tomorrow, and this has to do with helping the growth of natural history studies and patient registries, facilitating a rare disease coalition. So like Kim said, how she got locked in a room, we need to lock more doctors in a room together. So I don't know, I'll lock them in. I'll totally volunteer that. So, just bringing these doctors together because, like she said, one doctor may only ever see one cobalamin G patient, right? So let's connect our doctors together and let's share patient information so that we can understand optimal dosaging and optimal outcomes, and the quality of life for our patients is so important. As well as understanding that basic science, understanding that biochemical pathway. That picture I showed you, that big diagram, I'm hoping that it just keeps getting bigger and bigger. Like, you're just adding different areas to it, understanding this whole biochemical pathway because they all interact with each other. And that leads us into the optimal treatment. So understanding, we were talking just now about, optimal dosage for betaine, optimal dosage for hydroxycobalamin, what's the cutoff, what can cause lasting negative effects. We want to know all of that. Understanding if it's a subcutaneous shot or an IM shot. Like, these are all questions that as families we get asked all the time. As well as any additional amino acid supplementation. We'd love to see some studies about supplementation of things like folinic acid. We know they need it, but there's not any data on it. Additional methionine supplementation, does it help? Do kids need it? And then, of course, moving into new treatments, creating the creation of cell and animal models. And then, supporting research focused on novel therapies. Finding new doctors who will think out of the box and not just look at just the homocysteine, but the whole picture. And trying to figure out where else in this pathway we can provide support to the kids. Because, with these disorders, severe MTHFR, cobalamin G, E, they're hard to manage. And there's lots of different secondary effects that take place. As well as making sure that this research is focused on the quality of life for our patients. So if you take a big shot of hydroxycobalamin, it's painful. I have to give my 3-year-old a shot every day. And so I want to make sure that that's not a traumatic thing in his life. And I know he needs it to live, but where's the balance between how much does he really need and how much trauma is that going to cause in his life? So finding that balance for quality of life, I think, is very important. So next steps, what are we going to do with this research map? I am very excited. This is the moving forward, right? So we have a GPS now, but now we can press go, right? Like, that's the exciting part. And we've got directions now. We're going to set up a grant process, establish a scientific advisory board that will help us vet these opportunities to provide research. We're going to fundraise, right? Everybody, fundraise. Okay, we've got a race coming up this September. Help us fundraise, because the only way we can fund research is if you help us fundraise and get there, and know that we are trying our best to make sure that every penny that you fundraise is going to a phenomenal effort to improve your kid's life. We're going to continue contacting researchers and experts. This research map is not a final document. I will continuously update it. Creating a research consortium, bringing our doctors together, bringing the patient community together in events like this or online events. And one thing to offer too before I go, I don't want to take up any more time. If you're interested in the details of any of these graphics or specifics about your child's disorder or anyone's disorder, come find me. I'm happy to just at least explain what I know. Probably could find a handful of people more qualified, maybe Jen Sloan and Irene Manoli, but I'd be happy to share what I have learned in depth. I don't have the time to do that today. I'm hoping in the future maybe to provide a webinar that can go over some of that in detail, so you can kind of understand what's happening in the cells of your child in their body. So next up, you get to hear from the wonderful Irene Manoli. And she's going to now take this the next step and talk about the current state of therapies. And then you turn the time over to Jen. Thank you.
Thank you, Brittany.